Good morning, everyone. It's Sunday, March 29th. Boston Mayor Marty Walsh is joining us live this morning. Let's go on the record.
Stay at home. It will save lives.
The booming city of Boston goes quiet because of the coronavirus. How Mayor Walsh is working to stop the surge of the virus and get back to normal.
From WCVB Channel 5, the inside word from Washington to Beacon Hill. Today's newsmakers are going on the record.
It's 11 o'clock in the morning on Sunday, and welcome to OTR. I'm Ed Harding, along with News Center 5's political reporter Janet Wu. We are joined live in studio with Boston's Mayor Marty Walsh. But as you can see, even though the images on the screen may seem similar, we are socially distancing. We're well beyond the 6-foot distance between, and we're respecting the rules of social distancing. Janet Wu, let's start our questioning.
Mayor, thank you very much for being with us this morning. I know it's a very busy time for you. The numbers are really starting to jump in Massachusetts, but percentage-wise, the numbers aren't growing quite as much in Boston yet. Now, is this because of the lack of tests available, or is there something else at play here?
I think we're still waiting to get a lot of these test results. We're at 614 confirmed cases as of yesterday at 2:45. I'm just reading some numbers here. We have 47 people that have recovered from the coronavirus, and we have 2 people that lost their life. So I expect to see these numbers growing up as this week goes on. And we're really, people keep talking about the surge, and we haven't seen the surge yet. Although every day we've seen more and more cases, people be test positive for coronavirus.
Are you getting enough tests? Kits right now? Are you able to test everyone that needs to be tested on a daily basis?
Well, I think there's still going to be people that need to be tested, and I think that as these kits, we get more and more of these kits working with the state, it's going to be really important for us to get these test kits. Yesterday, we opened up our first responder for Boston Police, Fire, and EMS testing facility in East Boston, and we just started, so I'm not sure exactly the number of tests we administered yesterday, but having outside companies help us is really important to get as many tests as positive. And I think at some point we're going to move beyond talking about testing and really talking about what the next steps are, and I think that's where we're kind of transitioning to right now.
But you just said we haven't hit the surge yet, right? It's your belief we have not hit the surge yet?
No, I don't think we have, and I think that, we'll talk about in the show later on, but when the governor came down with his stay-at-home advisory, a lot of people adhere to that and are following the guidelines, and there are too many people that aren't paying attention to that right now, and that's a dangerous thing.
Speaking of the governor, are you as frustrated as he is with the inability to get the masks and the ventilators as promised by the federal government?
I think we're all concerned about that. I think we're concerned that we're not getting the equipment we need. We're getting requests as well. Our first responders are asking for more materials. We have hospitals and nurses and doctors that need more material. Our food pantries, quite honestly, where we're feeding the poor and the vulnerable, need more material. So it would be great if Washington could get that equipment and material down to us in a quicker fashion.
There are reports that masks and other PPE materials coming from the national stockpile is expired, and that the distribution is based on population, not on the size of the problems in each state. Does all this worry you?
Yeah, I think that right now, and I have not been too critical of individuals, but I think Washington needs to understand the importance of what all states are doing. I think some states like Massachusetts and cities like Boston and other places are taking this very seriously. I think there are other states around the country that aren't necessarily taking it as seriously as they should. Their numbers are a lot lower, and they should be looking to places like Boston, Massachusetts, like New York, like Michigan, and trying to keep your numbers down. And so I think that's number one. But to go back to the equipment stuff, it's something that, I think that the federal government, and you and I, Janet, talked off camera backstage a little bit here, I'm not sure if it's an issue of not giving it to states for certain reasons, or just they don't have the capacity to think about this. And my advice, if they're listening and if they're not doing this, is bring in military operations to be able to get this equipment out, because military has the basic understanding and the plan to move into an area quickly and move out of an area quickly, and have all the supplies they need to move into an area. And the same can be said here for these masks and medical gowns and the ventilators and all of the equipment that we're looking for, not just here in Massachusetts, but throughout the country.
The governor is asking anyone that arrives here in Massachusetts, and no matter how you get here, airports, trains, highways, whatever, to voluntary self-quarantine for 14 days. I will ask you directly, do you think that's really going to work?
I don't think necessarily people are going to quarantine. However, I'll say this: a lot of people that are coming from New York are coming because they're afraid. So I'm assuming that many of those folks that are coming to Boston and Florida and other places are getting out because they're concerned about the spread of the virus. Now, if they come here, whether you're a New Yorker or you're a Bostonian, the suggestion is that you basically shelter in place at home, except to go out for the basic necessities such as food or prescriptions. And if people adhere to those rules and do that, we can see, every expert's told us, we can literally slow the spread of the virus down by doing those things. But if you go out and interact with people, or you're coming here from another place, New York or anywhere, and you're sick and you're interacting with people, well, then what's happening is you're putting those folks in harm's way.
Do you think the governor of Rhode Island is going too far and having people from New York to track as they come in the state? If they're coming in the state and staying in the state, she wants to know where they are and stay where you are.
I'm not going to question what governors and mayors are doing. None of us have ever had to deal with anything like this, and a lot of what we're doing in the city, in the country, is talking to our peers. I'm on the phone constantly with mayors from around the country and talking about what they're doing in their city, what's working, what's not working, what do they anticipate, what didn't they anticipate. Governors are doing the same thing. People are going to have different ideas on how to try and combat the virus, and that's their job. They were elected to do that, not stop the virus, but they were elected to run their states, and I'm not going to second guess what governors or mayors are doing. All we can do is learn from them. Some of the things that we do are good, and some of the things that we do don't necessarily work. So I think we should continue to learn off of each other.
Mayor, I would like to talk about construction, but before I get there, I just want to clarify something you said earlier. Are you saying that you are fearful that politics may be at play here in the distribution of resources to the states from the national stockpile?
No, what I was saying about me personally, this is not the time to get into partisan politics. This is the time to continue to move together as one group of people, whether we're Bostonians or Americans for that matter. This is an issue right now that as a leader of a city who's responsible for 700,000 people that live in our city, I'm focused on making sure that the people have the services and everything they need in Boston to be safe. I want to do everything I can to keep the number of people infected with coronavirus down and work with folks. That's what my focus is right now.
Let's talk about construction. It's a pretty big controversy right now. You have banned all work in Boston. The governor wants it to continue in the rest of the state with major caveats and obviously very strict new rules. Do you think this will hurt Boston, and is there any chance you'll change your mind about this?
Listen, myself and the governor have had many conversations a few days ago, and I was asked this question, after the conversation was done, we moved on to something else. We are working, I want to make sure that every construction worker in the city of Boston is safe. There is no difference between a construction worker working on a construction site or a banker working in a bank, or a banker working in their offices in downtown or on the high rises. So we want to make sure that when construction starts in Boston, and we're working on policies and we're working with the state to make sure the policies are in place, that there's proper washing stations and there's proper procedure on site so that a construction worker has the same protections as our first responders do, quite honestly. And we're going to make sure we're going to continue to work through that. This week we'll probably be talking about those policies and asking developers and construction companies to start building those policies onto their job site. And then we'll monitor the numbers and see where we are. New York City shut construction down Friday, but it took them a long time to shut it down, and a couple of construction workers lost their life. And it's not the reason they lost it necessarily because construction wasn't shut down, but I don't view construction, except for emergency construction, different than I do what we're trying to tell people to stay home. At some point, we will get construction back up and running. We are allowing construction in the city of Boston in the hospitals to continue on, because that's really important, because we're trying to build capacity there. And we're allowing construction to happen in some residential construction, in the sense of if somebody is replacing a bathroom or a kitchen, things like that,
right,
because you can social distance.
Right.
It's very complicated on a construction site with 500 construction workers to social distance. And some of the trades, when you're working on there, you have to work next to each other because you're dealing with heavy equipment, heavy machinery, and heavy stock, so you don't have that luxury of 6 feet apart.
So let me ask you, you've set up a drive-through testing site at Suffolk Downs, especially for the city's first responders, the police, the fire, the EMTs. We know there have been reports of confirmed cases among those groups, which is completely logical. Yeah. How worried are you about the numbers and among those ranks dwindling, perhaps rising to an unsafe level?
We have to keep all of our first responders as healthy as possible and limit the ability for them to catch the coronavirus and also for their families. And also, when I talk about first responders, I talk about our police, fire, EMS, but I'm also talking about our nurses and doctors and medical staff, including quite honestly, janitors that are going in and housekeeping that's keeping the hospitals clean. So we have to do everything we can to make sure that they're safe. With the testing facilities, again, part of it is psychological. People feel if they have the ability, if they come down with the symptoms of the coronavirus and they're able to get a test quickly, we're able to get them psychologically, let's make them feel safe and that they're okay. But we also need to continue to work with them and get them information as much as possible. They're amazing people. They're on the front lines. I want to thank the police, fire, and EMS and all the doctors and nurses, and to the families of those loved ones that are watching today. Thank you. We cannot get through this without you. We need you. We need your family, and we need your family to be healthy and safe.
Mayor Walsh is with us. We're going to take a break on OTR Live this Sunday, last Sunday in March.